are going to learn about the Ambu bag. So the full form of Ambu bag is artificial manual breathing unit. It is also known as the bag wall mask. It is also known as the self-inflating bag, and sometimes some people say that it is also known as the manual resuscitator. So as you can see, this is the Ambu bag. Now, who has invented the Ambu bag? So it is invented by the Holger Hess in the 1953 and his friend Henning Rubin. Now, when it is used, so whenever we have to provide the high flow of the oxygen to the patient during the respiratory arrest or the respiratory failure, so during that time we are using the Ambu bag. It is also used during whenever the patient is in the ventilator and need the oxygen. Okay. Apart from that, whenever the patient is using the laryngeal mask or the patient is on the endotracheal tube, so during that time we are using the Ambu bag. The Ambu word comes from the ambulance. Now, very important thing that to understand that it comes in the different size. So basically 3 sizes are come. So this is the adult size. Apart from this, we can have the child as well as the infant size. Now you can see there is a bag. So bag size will be different. Now its capacity is 1600 ml. When you are using the infant, its size will be 250 ml, and when you are using for the child, its size will be 500 ml. Now, there are different complications that may also occur due to the use of the Ambu bag. Now this complication includes the volutrauma. Volutrauma means that the lung trauma due to the overstretching. If you just pressurize it very much, it may also lead to the barotrauma, and sometimes gastric infarction will also be there. Now this whole procedure of giving the patient oxygen through the Ambu bag, that is known as the bagging. Now we will see the parts of the Ambu bag. So basically it has the 3 parts. Okay. So you can see this part, as this part will provide oxygen to the patient. This is known as the outlet. This is known as the reservoir bag, and this part is known as the inlet. So basically 3 parts are there. So first we will see the inlet part. So there are, you can see 2 ports are there. One is for the oxygen inlet, which is the small one, and another is for the reservoir, or you can say the air inlet. So you can attach the reservoir also, and it also provides the atmospheric air. Okay, now you can see there is a valve of the yellow color, you can see. Now this valve is known as the inlet valve. Now this is a bag, you can see this bag. This bag is made up of the silicone, and this bag is also known as the self-inflation bag, because whenever you squeeze it and let it go, then again it will come into the own shape. Now you can see this part is known as the outlet part. Now this round part, that is known as the adapter, and its size is 15 millimeter, which is the standard adapter size, so that it can be attached patient to the direct mask also and to the endotracheal tube also. Now you can see this yellow color valve. This valve is known as the one-way valve and also known as the fish mouth valve. Now why it is known as the fish mouth valve? So you can say whenever we squeeze it, it will open like a fish mouth. So it helps to deliver the patient oxygen whenever we squeeze it, and whenever we let it go, again it will close. Now you can see there is again a valve, this valve. This valve is known as the pressure release valve and also known as the pop-up valve. So the main purpose of this pop-up valve is whenever you squeeze and there is a more oxygen, so it will just release the excess of the oxygen and prevents the lung trauma. Now we will see how it works. So first you have to attach the mask to it, and then this is the oxygen connector. So you can attach. Now this oxygen connector can be further attached to any of the oxygen source. It may be a cylinder also, or if there is a centralized then also. Now if you have only one person who is resuscitating, then you can use this position. Your hand should be like this if there is a single rescue, and you have to press it like this. Now whenever the person is adult, you must remember that it should be pressed for 5 to 6 seconds. So you can count like this: 1, 2, 3, 4, 5. Now if the person or the patient is neonate, infant or child, then remember it must be 3 seconds. Now if suppose there are 2 resuscitators, then how you have to hold it? If there are 2 resuscitators, you can see your position should be like this, and this is the perfect position to give the patient Ambu bag ventilation. So that's all regarding the Ambu bag ventilation. Thank you.